you have to feel like you get along with the people you're working with, because I think a lot of times we forget about that when we're coming out of residency or coming out of fellowship. We think, oh, you want to know that there's this volume or this much call or what the salary is or something like that. You forget that you're hoping to commit to, working with these people for, for as long as your career goes, as long as their careers are going.
Well, thank you all for joining us this evening. We are here today with Jillian Chong, MD, and she is going to share with us this afternoon part of our program called Focus Through the Generations. We realize that there are 4 generations of actively practicing ophthalmologists in the US today. So Vision Care Connect wanted to have some fun with that and interview these 4 generations and see what their thoughts are about what's happened in our industry, what's happened in our world with COVID, and also just where they're going to go in general and any advice that they would have to their next generation or even the generation ahead of them on how to leave it better for them. And I want to say thank you to our partner, Breeder Healthcare, and they made part of this possible and we're really grateful for them. So let's get started. Hi, Dr. Chong, how are you?
I'm doing well. Thanks so much for letting me be involved.
Well, thank you for offering and being a participant. We love this. I want to give you a moment just to introduce yourself and let the audience know who you are and a little bit about you.
Well, I'm Jillian Chong. I'm a cornea and refractive surgery fellow at the Cleveland Clinic. And part of the reason I was so interested in this is, when you said focus through the generations, I'm a 3rd generation ophthalmologist, but not directly. My grandmother was an ophthalmologist and she was my inspiration my whole life. She's an incredible woman. She's the first woman in her residency program at UCSF in the 1940s. Just a really cool person doing her cataracts with a Von Graefe knife intercalf. Just an incredible person. And then my uncle was an ophthalmologist. But I'm the only one in my family who's currently practicing. So.
Well, that's awesome. So you're 3rd generation and your grandmother, wow, what a pioneer.
She's an incredible woman.
Way ahead of her time. Go her. I like that. That's wonderful. What was your grandmother's name?
Her name was Emma Dong, and she practiced in the Salinas Valley in California.
So she inspired you.
Very much, yeah. So everybody else's grandmothers were making them pie and giving them teddy bears, and my grandmother gave me a microscope for my birthday. So it was at a scale model eye. I had a scale model eye, I think, since I was like 6 or 7. So it was, she definitely knew. She knew where she wanted me to go.
Oh, that's wonderful. So you've made her proud. That's good. I'm glad.
Yeah. No, I couldn't imagine doing anything else. I'm so happy.
You look happy. And you even just got through with an emergency and you still look happy at the end of the day. So that's pretty impressive. Well, I guess this leads right into the first question, but I don't even know if we have to ask you that. When you were 12, what did you want to be?
I wanted to be an ophthalmologist. I did not know I wanted to do cornea though when I was 12. So I've met my goals and growing past them. So
that's great. And what made you have the interest in cornea and refractive?
So I went into ophthalmology because I wanted to take people from seeing poorly to seeing well. And it just really felt that cornea is the specialty that does that the most frequently with the most success. So I appreciate our glaucoma colleagues and our retina colleagues who can take the low vision patients and give them better quality of life. But I think I'm a little bit of a Tinkerbell. I need some applause to survive, and refractive surgery gives me that applause.
You want to give a little shout out to your retina buddy who loaned you the ring light?
I know, Tukaneet Sodhi really saved my butt, giving me a light that makes me look prettier than I am.
We'll have to put that in there for you, so he'll like that.
I'll make sure he sees it.
Well, let me ask you something. Now you're just in your fellowship here, but what's the most interesting case that your grandmother ever told you about?
She never told me about cases. She told me about people. So she had just a collection of people that were sort of her long-term patients, and she just built these relationships with people, and she became this really strong member of her community as a woman in the 40s and 50s, and she got to help out other people. It wasn't just in practice, and she was in a farming community where it was really important to build ties, and she got to be a leader, and it was just an amazing life for a woman in that time. I remember when she was in her 90s, she had a fall, and she bruised her hip, but she didn't end up breaking any bones. She's in the rehab facility, and like all of these former patients were there with her, and they're like, "Oh, Dr. Dong, do you remember me? Like, sit next to me at lunch," stuff like that. So she was like the most popular girl in school at her rehab facility. But she just, she knew everybody, and she knew everyone's stories, and she treated whole families, and there wasn't a day that went by that she didn't love what she did.
I hope you're the same way. I hope your life is that way too, because that's, one of the gentlemen that we interviewed, Dr. Miles Kraft, said to me one day, he goes, "Kid, if you get a job you love, you'll never work a day in your life." And
exactly.
I love what I do. I don't feel like I've worked a day in my life, and I've enjoyed what I've been doing. So that's
exactly.
Yeah, I love it. As far as you had your grandmother, she mentored you, and what skills do you think that you have personally that brought you in to ophthalmology? Not just your desire, but your skills. What do you think that is?
That's a really good question. What you mean? What skills do I think made me a good ophthalmologist, or what skills did I follow that led me here?
Kind of both. What skills did you think going into this that was going to bring you success? And going forward, what skills do you think these could be? Mental, emotional, physical, whatever skills that you feel are going to bring you success?
Well, I love getting to know people. I love hearing people's stories. I think that's what brought me, I did a little long route, and I thought maybe I wanted to do something besides medicine for a while. So I looked into law, and I looked into chemistry and things like that. And what I really found is that I really like people's stories. And when I went and did a summer abroad, and I felt like, the best way to, the thing that makes you a good doctor is being able to listen to people and find out, sort of close read the stories that they're telling and figure out what they need. And that's what brought me back to medicine. I feel like you get like a good amount of chair time in ophthalmology, and you being able to tease out people's stories pretty quickly without making them feel rushed is a really important skill. I think that's one of the skills I feel like I'm most proud of that I've picked up and developed over time. I think, just that we always wonder, what ultimately is going to separate us from the machines when we're trying to automate so much. And it's that personal relationship that really makes a difference.
I agree. I don't think machines will ever replace that. Even though they can listen to me and answer me almost correctly, I still prefer not to talk to a machine. I'd rather some sort of smile or feel some kind of emotion, so I think you're right there. I think that's what's going to set you apart for that. Let me ask you something. Why did you choose where you are for your fellowship?
Oh man. So I knew going into fellowship applications that I was really interested in refractive surgery. But I also wanted to be, good at transplants. I wanted to do cornea because I want to treat corneal disease. And when I was looking at programs, usually they would focus on one or focus on the other. But what I loved about the clinic was that we've got Brad Randleman and BJ Dukes, who are the editors-in-chief of JRS and JCRS respectively, just titans in refractive surgery. But then we also have high volume transplant surgeons. Like I'm going to graduate with like 75 to 80 DMACs, and I've already done 4 DOLCs, and we're only 2/3 of the way through the year, almost 3/4, I guess now. But I just feel like it's the program that I found that gives me the most opportunity to expand my skill set, and it doesn't make me pare down to just one or the other. If I want to do cornea, I'll still be able to do cornea, but I still get to make sure that I get those great refractive outcomes in my LASIK, PRK, and SMILE patients. And I've even got to put in a couple of ICLs, which has been a lot of fun. So the surgical volume here was incredible, and the mentorship's even better.
That's great. Those are all great reasons. And you're in a good field. You're in a field where most of the time you're going to have wonderful results, and patients are going to be so ecstatic. You're still going to have some that, you're not going to be able to do exactly what they want. But when you think about corneal grafts and you think about taking people's eyesight to where it never has been in some cases, it's pretty darn exciting. I applaud you. I agree with everything you're saying.
It's a lot of fun. I feel it's a huge privilege to have had the opportunity to do corneal and refractive surgery, and I'm looking forward to spending the rest of my life, or the rest of my working life, continuing to do as much of it as I can.
And are you looking right now for practices? Are you looking to hang out your own shingle, or are you gonna doing something? What do you think the economic climate will lead you to?
So I'm about to sign with a practice in Beverly Hills, and they're a friend of a friend, sort of is the managing partner. So I got really lucky with the opportunity to interview, and it sounds like it feels like a really great fit. There's cornea volume that's untapped that I'm looking forward to being able to take care of, and it's a market of people who are interested in refractive surgery. So I'm hopeful that those skill sets will be able to be put to use. But it was a hard choice. There are so many great practices out there, and it's always difficult. And it's the first year that I've been able to make a choice about where I'm going since applying for medical school like almost 10 years ago. So getting the opportunity to make a decision was strange, but really exciting.
What advice would you give to others that are in your situation to look for? What are some of the checkpoints on their list that they need to look for when they're joining or looking to join a practice?
That's a great question. I think the two things for me that really ended up being selling points for when I was interviewing were, you have to feel like you get along with the people you're working with, because I think a lot of times we forget about that when we're coming out of residency or coming out of fellowship. We think, oh, you want to know that there's this volume or this much call or what the salary is or something like that. You forget that you're hoping to commit to working with these people for as long as your career goes, as long as their careers are going. So it's really important that it fits even more important in a job than it is in fellowship. And I tell you all the time that you shouldn't go to a good fellowship if you don't like the people there. You'll be miserable for a year, and this is the rest of your life. But the other thing that I think that was really important that people told me was, it's a huge decision, but I think 50% of people, their first job isn't their last. So you're going to be deciding between a lot of great places, and it's extremely exciting time to be an ophthalmologist, and there are going to be a lot of great opportunities. But when you pick one, you don't have to worry that you're going to be looking back with regrets, because your career is just starting. So A, there's a lot of great options out there. B, you got to like the people you're working with, and C, you're making a commitment that you hope is going to be forever, but it doesn't have to be.
That's really good advice. And what made you know that this one was the one for you? I mean, I'm curious because I help place people in practices. So I'm curious, did you work with the practice and the staff? Did you actually get to spend actual working time with them to know that you're going to be a fit for them as well as them a fit for you?
I didn't end up spending time working with them just because it was so far away to travel. So I didn't get to have as much time with any of the practices I interviewed with as I would have liked to. And it's such a hard thing to talk about, because as I ultimately was deciding between two practices, and I loved both of them. I thought they were both fantastic people with fantastic business models who were, the cutting edge of what they were doing, who were great mentors. And I thought that there's no downside for either of the two practices I was deciding between. But ultimately, I'm in a relationship with somebody in Los Angeles. The other job was in San Francisco, closer to my family. And I made the choice that if I really believe in my relationship, I can't stay doing long distance for another forever. So that was what kind of sealed the deal. But I mean, it's I know enough about the practice that I'm working with that I know they're really honest people. And I think that was something that I was told is you can't, unless you hear it from a lot of sources, you can't just assume that everybody's going to behave ethically all the time, which is, it's surprising coming out of training, because they spend so much time making sure that we are aware of the ethical implications of our decisions. But it was so important that everybody from the other people who worked there to people in industry who I spoke to, and friends or other people in the area who practice ophthalmology universally said, this is a person who practices ethical ophthalmology, and they're extremely fair and they're extremely straightforward, and it's good. It's easy to have a good working relationship with them, and all those things were really reassuring, and a big part of the reason why this was my top choice.
So really, all relationships pointed there, and that was good for you. That worked out well.
Yeah, I got really lucky.
Lucky. Good for you. I wish you all the best in that. I think that's going to be wonderful, and it sounds like you did your homework well and know what you're doing. I have a great question for you now. We've been asking people, if you could have lunch with anyone, fictional, real, dead or alive, who would it be and why?
Oh man, this is gonna sound really cheesy because we've been talking about this the entire time, but my grandmother passed away when I was applying for residency. So she never got to see me as an ophthalmologist. And I would like to ask her, like, what was surgery like then? What were your best patient stories? The questions you're asking me, because I even if I'd asked her, even if she'd told me before, it wouldn't have been, as a colleague. It would have been as a grandmother telling, a dumbed down story to a kid who doesn't really understand. And yeah, I know that she sat with my uncle when he was just starting to practice, and they went to the eye bank, and she taught him how to use Van Grafe, even though they were doing extra caps when my uncle was practicing. But she just wanted him to, she wanted to teach him the things she knew. And I would have loved to just, have a couple hours with her, just, hearing her stories and learning from her. I would love that.
That's beautiful. But her legacy lives on in you. So get your own stories to be able to hand down to your children one day and they become ophthalmologists. So that'll be
I'm looking forward to it. My children and grandchildren will have generations.
It's something, right? It doesn't matter, whatever. How has COVID affected your practice there at the university? What all has happened with you guys in 2021? And what out of all of those things that you had to do different and practices that you had to have, what will you take with you and remain the same in 2021?
Oh, that is a fantastic question. So I started the pandemic as a resident at NYU. So I was in New York City. And so my training was very significantly affected by the pandemic. They took us out of the ORs and they reassigned all of us to, to something that could be useful or helpful. So a lot of people were on call services. I started off by taking the physicians who were repurposing themselves, who volunteered to work at Bellevue, which is the city hospital, the primary tertiary center of Manhattan for the underserved. And so a lot of people volunteered to work at Bellevue, and I was in charge of making sure they were onboarded, that they got all their testing and paperwork and everything filled out, that they were able to get their N95. So I did a lot of administrative work coordinating that for the first few weeks. I did a week on the floors of the VA, which just reminded me how much I love ophthalmology, and how much I've committed so much of my memory to ophthalmology and forgotten a lot of things about medicine. But it was a valuable experience, and I'm glad that I was able to participate. We've been, since coming to the clinic, it's been different. I mean, we never got hit quite as hard as New York got hit. So nobody was ever mobilized to the floors from ophthalmology here. But we've been really good about room turnover. Like I often am cleaning things top to bottom myself, just because, there's a lot of people working at the same time, but you're never going to be staffed up enough that you can just expect somebody else to clean your room for you if you want to move efficiently. I think cleaning that much started making me a little uncomfortable about what we were doing beforehand. Like, cleaning the chair down every single time seems like, at first it was like, man, this is overkill. But then I was like, it's a different person sitting in this chair every time. And like, who knows where those pants have been? And like, it's probably not a bad idea to at least clean the handlebars. You're going to be touching everything. And I'm definitely going to be taking that sort of deep cleaning philosophy with me. I'm definitely not taking those, the little slit lamp shields. Those things are awful. I have like the tiniest PD. I'm a cyclops, and I can't push the slit lamp close enough together to see anything, and they're on, so I have to take it off every single time. And then when I take it off, I have to apologize to the patient, because we're in my region, there are about as many people who don't believe that all these things are necessary as people who do. So I feel like every single time I have to be like, I'm not taking this off because I don't value your safety. I'm taking it off because I can't see your eye if I leave it on. I can't see in 3 dimensions, and I'm really sorry. So I'm definitely not taking that one with me. But I think the deep cleaning protocols I probably will.
Yeah, I've heard a lot of different stories about that. Some are, I'll always wear my mask no matter what, especially when I'm at the slit lamp, because I realize how close I am to somebody.
Yeah.
But I think we all have learned about the deep cleaning benefits, because I think even with the flu, just the normal flu, I think we could probably save a lot of lives if we had done that in the past, just really wiped everything down, because we're all guilty of working too hard. And if we have a doctor's appointment, we don't want to miss it. And if we're sick, we still go, and we still go to work. So yeah, I think that's a great deep cleaning. That's a good thing. I would take that. Yeah.
I will
So
say, like as much as I hate the masks, like there are times after I've had like a big cup of coffee or like some onions at lunch where I'm like, this isn't the worst.
yeah, especially when you don't have time to go back and brush your teeth and do mouthwash, keep going, especially with what you're doing. You're on the run. So that's pretty cool.
Right. And I could save a fortune on lipstick and half a face of foundation.
My foundation has lasted a whole year because of this, because I only
Yeah.
have part. It's pretty cool actually.
Yeah.
I make up quite a bit because it's, you
Yeah.
have to really make something look good. So, so you do that. So what has been your most interesting patient that you've encountered in your residency and your fellowship?
Oh, that is a great question. Let's see. I think I've had a series of patients with interesting ulcers. I'm not sure if this counts as my most interesting patient. I guess we've had interesting is a broad enough word that I feel like I could put a whole bunch of people in that category and make them the most interesting for really different reasons. Like there are patients who had these sort of freak accidents. There are patients who are just like incredibly interesting people. Then there are the interesting patients, and but I think the thing that I thought was sort of captured my imagination, I guess, was just we've had a lot of weird bugs this year in our ulcers, and it seems like a lot of these bugs are respiratory bugs or oral flora, and I feel like this mask wear with contact lenses is putting a lot more people at risk of bugs that are unusual, because your mouth is full of bacteria, and that's normally okay when you're not blowing your spit all over your contact lenses all the time. Usually you'll say like, oh, everyone's got the story of like this one patient who's cleaning contact lenses off with their tongue or something like that, and that's why they got this weird infection. But now these weird infections are becoming more and more common, which hopefully we don't have to take with us much longer when we can all be vaccinated and get rid of our masks. So I guess it's not just one patient, but it's a few. And I find a lot of these patients have a lot more difficulty with a lot more severe pain also than most ulcer patients who are also in a lot of pain. But it's been one of those experiences where you're like, gosh, this is awful. But it's also like, it really makes me appreciate again the value of refractive surgery.
Yes.
Because it's not just about improving the quality of life for people who want to wake up and see, which on its own is amazing. But I mean, it's a safety thing for a lot of people who can't function without their contact lenses, who have to wear them all the time because their Coke bottle glasses are impossible to see peripherally with because they're just too thick. I mean, these people are sentenced to contact lenses, and in a world where weird infections are becoming more common, and refractive surgery of all kinds, it could save a lot of vision.
Very true. I have a question for you. I'm going to give you a scenario.
Okay.
Scenario came to me this week, and I want to know how you would answer.
Okay.
Someone who's 36,
Mm-hmm.
they've worn contacts their whole life,
Mm-hmm.
since they were 13, but they had glasses before that.
Mm-hmm.
And they want to have LASIK.
Mm-hmm.
What would be your recommendation, since they're coming into presbyopia land very soon?
Yeah, so I mean, I think that at 36, it's a lot of this it comes down to good counseling. I see some people in their 40s who have a little bit, but I would usually say I would not push for anything more monovisiony than like a half diopter offset. Just because I want them to have good usable vision. They're still accommodating a lot at 36. I would be inclined to treat them just for plano in both eyes, but if they're really concerned about it, or if they're not likely to come back for enhancement, or if they have sort of a questionable amount of tissue available, like a PRK for a thin cornea or something like that, then I might consider like a half diopter offset just to give them a little bit more time. Yeah, I think at 36, I probably wouldn't offer much more than that.
Good. And I think you've been involved in the Myloop study as well.
I wasn't involved in the study, but I did. I had a little interview about Myloop. We use Myloop very liberally in our residency because our attending's philosophy was, look, you're going to be starting off using a lot of phaco energy no matter what, just because you're not comfortable yet. And so if you can save them a little bit of endothelial damage by learning how to use the Myloop, and also take a great tool with you, then that's that's a win for everybody. So the VA, we Mylooped almost all of our first cataracts, and then we had some really interesting patients who would have these like incredibly dense cataracts, and then there's no cortex in it, so it just kind of rolls up on you, and a lot of times it'll roll up a little bit anyway. And rather than putting it back in the bag and trying to spin it and cut it again, we thought, wouldn't it be nice if it's sitting up already, you just kind of loop it like a lasso and cut it into hemis, so you already have your first quad out, and it's easier to take. So so we talked a little bit about that in an iTube interview, which is very cool.
Here's my last question for you. No, I have one more question for you. I'm sorry.
Okay, great.
I look at my notes and I'm like, wait a minute, I have one more question. What do you do outside of ophthalmology that brings you enjoyment, and how you spend your time?
Man, there's so much other stuff that I used to do pre-COVID that I can't do anymore, and stuff that I did pre-medical school that I can't do anymore that I'd love to get back to when I can. Like I used to be a fencer, and I loved fencing. I was a foil fencer, and I was not not Olympic quality, but I did like local competitions, and I went to nationals once. It was a lot of fun. I'd love to get back to that once I'm established again. But really mostly it's just, I've made incredible friends in training. Residency and fellowship is rigorous. The hours are rigorous, demands are rigorous. And, I've got one of my best friends in fellowship is this amazing chef. And, she's inspired me to start cooking again a little bit more. She bought me a pie, like a little ceramic like pie tin, and so I've been making pies again, which my mom has this amazing pie crust recipe that was passed down from her father who owned a restaurant, and so I've been making a lot of pie and fattening all my friends. And then what was it? Sorry, I missed that.
Some of those this way, we're okay with that.
Yeah, exactly. And my co-fellow is also an incredible chef. She and her husband are great cooks. So I've gone over there a few times, and we've I do, one of our sites is next to a Costco, and I live alone, but I shop at Costco because it's close by. So I end up with just this huge surplus of random ingredients. So I had like this giant bag of lemons, and I went over to my co-fellow's house with like six lemons, and I was like, what do I do with these? So we ended up making like a soup and some lemon bars. So I guess creative uses of ingredients. I guess we've been it's like Iron Chef, like when they have like a secret ingredient, you have to figure out what to do for an entire meal's worth of lemons. We've been doing a little bit of that. So
get your mind off eyes, and you get to do something fun for a change. I like that.
Exactly. Yeah, and it's been great. Plus, you always end up with a little extra. So it never hurts making and keeping friends to leave food around for people.
Absolutely, absolutely. Well, this is truly my last question, and then I'll let you get to the evening. I know you're just new out, you're in fellowship, you're just doing this, but what technology have you seen that has impressed you the most now? And where do you see technology heading for 5 years down the road when you are in your own practice?
So I'm really excited about Smile. I think that Smile has a lot of opportunity to be really a premier refractive surgery procedure. I recognize that it still has some kinks to work out, and there's definitely a learning curve. But I think that for the early 15-year data on stability is really exciting. I think there's some things in the pipeline people have been talking about, sort of irrigating lenticules and stuff like that. I mean, it's a whole new frontier of refractive surgery, and to be in already a very technologically forward profession where you're at the dawn of a completely new procedure is really exciting. And so I'm looking forward to seeing where that goes. I think I got really excited and I ended up writing a review article about it before I ever did a case. But I love it. I really think that that's going to be a huge part of the arsenal in the future. And it's exciting for a lot of patients with with normal corneas, but really high corrections. I think the stability value of taking deeper stroma is really great. And then, for our campers and our deep sea divers and our people who are going to be out of the help of an ophthalmologist for long periods of time, who are worried about a flap but don't want to have to go through the healing period of PRK, it's a great option. I mean, it's a really exciting time to be a refractive surgeon.
Well, I agree with you. And I think that we have so much to look forward to: technology, procedure, and process, and how to do these procedures. Like, Myloop may be old news to some people as far as they used to, do the breakup and the, cut and chop, or then phaco came, then, now we're learning that there's still a purpose for this. There's still something that's valuable for. I think Smile has a lot of positives. I think that it's not been utilized or marketed or actually explained or educated to the patient, much like when PRK first came out to educate.
Right.
I think that that you probably can do that. You have enough enthusiasm. Maybe when you go to this next practice, they're going to let you take that by the neck and do it for it. That would be good. So
I certainly hope so.
yeah, I think you will. I think you're going to be great, and we're going to want to see you in 5 years and see where you are. I'm going to follow you.
Absolutely. I mean, it's such a pleasure to meet you. Thank you so much.